So the USMLE Step 2 CS or clinical skills has been canceled. My first thought is, where is my money? Where's my refund? For those that don't know, the Step 2 CS is a clinical exam. This is an all-day exam, like an 8-hour, 7 to 8 hour ordeal that you take during your third year or fourth year of medical school. There are a number of different board exams that you have to take. There's Step 1, which is a written exam, 8-hour exam that goes mostly over first year and second year material. This exam was just changed to a pass-fail. I have another video about that. I'll put that right up here and my thoughts on that. But a few days ago, it was just announced that the Step 2 CS has been canceled. Well, what does this mean? Really nothing. This exam was useless. I was looking at the cost of this exam. It's been a few years since I've taken it, but it was $1,500. So what happens is you have to register for this exam, you have to pay for it, and it's only offered in certain cities. I had to fly from Washington, D.C. to Houston, Texas, get a hotel room, get a flight, rental car, the whole 9 yards, and I'm pretty sure I spent about $2,000. So for the first year medical students, second year medical students, you can rest assured that you're probably going to save about $2,000 from not having to take this test, which is a good thing. And no one really cares about this test. There's a 95% pass rate kind of overall when they're looking at MDs versus DOs. I believe the foreign graduates or medical students have a slightly lower kind of pass rate, but overall, most people pass it. It's almost one of those things where you hear of someone failing Step 2 CS and you just wonder, like, what the hell? What went wrong? Essentially, what they're trying to do is test your communication skills, test your kind of bedside manner. Don't get me wrong, these things are important, but not as important as $2,000. And as you can imagine, how many medical students take this exam per year? They're making a lot of money off of this, which I think it doesn't change anything or doesn't tell how good or bad of a doctor that you will be. So I think it's actually a good thing that they're getting rid of this. I wish they would have did that years ago when I was going through the years, and I want my money back. But for the students that are currently going through residency applications and going through the process, maybe your third year or fourth year medical student, this won't affect anything whatsoever. As we talked about, the Step 1 going to a pass-fail, all the emphasis is going to be applied to the Step 2 CK or clinical knowledge exam. And that's going to be the most important exam besides your clinical rotations. But now with everything going on with COVID, those are kind of thrown out the window also. So this Step 2 CS, it's a 8-hour kind of exam where you go in person to these sites. They have paid actors and you have to figure out what's wrong with the patient. So they have it set up like a hospital or a office setting. There's a chart on the door. You have to quickly read the chart. Oh, Mr. Jones is here for chest pain today. And you have to be able to figure out what's wrong with that patient, go in and talk to them. These are paid actors and they may say, hey, I have chest pain, it's going to my left arm. So you have to know, you need to order your cardiac enzymes, you need to get a chest x-ray, you need to order an EKG, you need to be able to treat that patient appropriately, get a cardiology consult. And you're graded on how effective and efficient you are in terms of working up these patients. These things are really important, but I think this exam was completely useless. And years ago, when I was going through the years, we were thinking the same thing, like, why do we have to go way down to Houston, or I believe the other place was Chicago or Philly or somewhere like that, and take this freaking exam? But good thing they got rid of it. That's a positive. For the students, the foreign medical students, the students from out of country, those students may actually benefit from this, given that that was one hindrance to getting into a U.S. residency for a lot of students, because some students are not really proficient in terms of their English language, or English language may not be their first language. So this exam was kind of to weed out some of those students and make sure that that communication, that language barrier is not there. So I think this is a good thing. We'll see what happens next. There are some talks about they're going to revise it and turn it into a whole different type of exam to test interpersonal relationship skills or communication skills. And we'll see what comes out of that. But for now, the Step 2 CS has been canceled. Let me know your thoughts. Do you guys think that was a good thing or a bad thing? Put it in the comments below. This is Dr. Webb. Thank you for watching this video, and we'll see you next time.